Are you waking up to pee once, twice, or even several times every night? You might blame it on drinking too much water before bed, but sometimes frequent nighttime urination can have other causes. Kidney problems are one possibility, but they're not the only one. An enlarged prostate, diabetes, certain medications, sleep problems, or changes in fluid balance can also play a role. So today, we'll look at 7 possible reasons you may be getting up to pee at night, and which changes are worth discussing with a healthcare professional. First, let's look at one kidney-related reason that many people don't realize can affect how often they urinate at night. One possible reason for frequent nighttime urination is a change in how your body handles fluid. Your kidneys continuously filter your blood and help regulate how much water leaves your body as urine. Normally, your body tends to produce less urine while you sleep, but that pattern can change with age or with certain health conditions, causing some people to produce more urine during the night. That doesn't automatically mean kidney disease, but if you're repeatedly waking up to urinate, especially if the change is new or getting worse, it's worth discussing with a healthcare professional. Another possible reason for frequent nighttime urination is high blood sugar. When glucose levels become too high, the kidneys may remove some of that excess glucose through the urine, and water can follow it. That can increase urine production and may also make you feel unusually thirsty, creating a cycle of drinking more and needing to urinate more often. Frequent nighttime urination doesn't mean you have diabetes, because many other conditions can cause it. But if it happens alongside unusual thirst, fatigue, blurred vision, or unexplained weight changes, it may be worth discussing blood glucose testing with a healthcare professional. But blood sugar is only one possibility. Another common reason can involve the bladder itself. Sometimes waking up to urinate has less to do with the kidneys and more to do with the bladder. As we get older, the bladder may not hold as much urine comfortably, which can increase the urge to use the bathroom. An overactive bladder can also cause a sudden or frequent urge to urinate, sometimes including several trips during the night. Urinary infections can cause frequent urination too, often with symptoms such as burning or discomfort. So frequent nighttime urination does not automatically point to kidney disease. If the change is persistent, painful, accompanied by blood in the urine, fever, or other unusual symptoms, getting medical advice can help identify the actual cause. And there's another factor many people overlook: the medicines they take every day. Another possible reason for frequent nighttime urination is medication. Some medicines, particularly diuretics, are designed to help your body remove extra salt and water, which can increase urine production. Depending on when these medicines are taken, some people may notice that they need to urinate more often later in the day or during the night, but medication timing should not be changed on your own. If nighttime urination started after beginning a new medicine, or if it has suddenly become much more frequent, mention it to your healthcare professional or pharmacist. They can review the medication and decide whether any adjustment is appropriate. But there's another reason: fluid can build up during the day and return to your circulation when you lie down at night. Another possible reason for nighttime urination is fluid that has collected in your legs during the day. When you stand or sit for long periods, gravity can cause some fluid to move into the tissues around your ankles and feet. When you lie down at night, that fluid can shift back into your bloodstream. Your kidneys may then filter more of it, which can increase urine production while you're sleeping. This can happen for several reasons, including prolonged sitting or standing, but persistent swelling can also have other causes involving the heart, veins, medications, or kidneys. If swelling is new, worsening, or accompanied by shortness of breath, seek medical advice promptly. But if nighttime urination comes with a weak or interrupted urine stream, there may be another explanation worth knowing. For men, especially as they get older, an enlarged prostate can be another reason for frequent nighttime urination. The prostate sits below the bladder and surrounds part of the urethra. When it becomes enlarged, it can interfere with the normal flow of urine. That can lead to symptoms such as a weak urine stream, difficulty starting, stopping, and starting during urination, feeling that the bladder hasn't completely emptied, and needing to urinate more often at night. These symptoms don't automatically mean prostate cancer or kidney disease, but if nighttime urination is persistent or comes with difficulty urinating, pain, blood in the urine, or an inability to urinate, medical evaluation is important. And finally, there's one important question: When does nighttime urination become something you shouldn't simply put down to getting older? Getting up once during the night can happen, especially as we get older. But if you're regularly waking up several times to urinate, and this is a new or worsening change, it's worth finding out why, rather than simply assuming it's normal aging. Talk with a healthcare professional if frequent nighttime urination is persistent or comes with unusual thirst, burning, or pain when urinating, blood in your urine, swelling, a weak urine stream, fever, or other new symptoms. And remember, frequent nighttime urination has many possible causes. Kidney disease is only one possibility. The right evaluation may include a review of your symptoms, medications, blood pressure, blood sugar, urine tests, and kidney function tests, depending on your situation. So, waking up to pee isn't automatically a kidney warning sign, but a persistent change is something worth understanding. So, waking up to pee at night doesn't automatically mean you have kidney disease. There are many possible explanations, from fluid balance and diabetes to bladder changes, medications, prostate problems, and other health conditions. If your nighttime urination is new, persistent, getting worse, or happening alongside other unusual symptoms, don't simply assume it's part of getting older. A healthcare professional can help determine whether you need urine testing, blood tests, medication review, or another evaluation. And if you have severe pain, blood in your urine, fever with urinary symptoms, sudden inability to urinate, severe shortness of breath, or a sudden major change in your health, seek medical care promptly. If this video helped you understand why you may be waking up to pee at night, give it a like and subscribe to VitalBites. This is week 1, day 6 of our 90-day healthy aging series. Tomorrow, we'll look at another everyday change that could have more than one explanation. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you have persistent or concerning symptoms, please consult a qualified healthcare professional.